with the EPAs in addressing contamination throughout the state of Illinois. As part of that, we have a cooperative agreement, which is what our section is funded by, with the Agency for Toxic Substances and Disease Registry. How many of you have heard of ATSDR before? Wow, this is a good crowd. Usually nobody will raise their hand. It's a federal agency associated with the Centers for Disease Control and Prevention, and where CDC looks at the bio-threats that there are out there, the bacteria, viruses, things of that sort. ATSDR is the chemical portion of that response. So they take a look at the different toxic chemicals and things that can affect human health. And so that's who we work closely in partnership with. These are the core responsibilities of our section, and our primary one is to evaluate hazardous waste sites. And so that's what we're funded to do through that cooperative agreement, and that is the brunt of what we do here in Illinois. So anytime there is a hazardous waste site identified by either US EPA or Illinois EPA, we take a look at it to determine if people are being exposed, and if so, to what level, and if there will be health effects from that exposure. And then we work in cooperation to try to find remedies to eliminate the exposure to any hazardous chemicals in the environment. That's our main duties, but of course, as most places, we have lots of other side things that we work on and that we do. And so these are some other things. Basically, we are the agency and the section for the state of Illinois that answers any questions from citizens of Illinois about exposures to hazardous substances and potential health effects. So we get lots of calls about that. We also are the only agency that deals with citizen calls about mold contamination and indoor air quality. And so that takes up a big chunk of our time, especially with press articles and such with mold. And so we do all sorts of things like that. We also do a lot of education. We do workshops. I've actually presented in this room a couple of times in different formats. We do chemicals and school safety workshops for teachers, and I'll touch on that project a little bit more later in the presentation with the storage and use of chemicals in schools. We deal with methamphetamine laboratories, which I'll also talk a little bit about because that can be considered emerging because of the toxic chemicals involved in the production of methamphetamine. We have a person on staff who deals with children's health issues specifically, and so anytime children might be involved in an exposure, they look at that. And then we also work with the fish advisories in the state of Illinois for the mercury PCBs and chloridane advisories. So we have a lot of different things that we do in the toxicology section. We have 5 full-time employees and 2 interns in our section. So we're not a large section, but we have a lot of responsibilities for the state. To be honest, when I was asked to do this presentation, I was perplexed because we talk a lot about certain contaminants and chemicals, but we had never actually been asked to talk about emerging contaminants in the environment. And so as I started to develop the presentation, I got to thinking, there's really 2 different classes of emerging contaminants. There's one that's truly new, which are things like pharmaceuticals in the water supply or things that we've just discovered are new. I'll talk a little bit about polybrominated diphenyl ethers and things like that. These things we've discovered are more toxic than perhaps we first suspected. But then mostly, to be honest, what our department deals with is the old contaminants presenting themselves in different forms. So the old becoming new. So I'm actually going to talk quite a bit about mercury, about lead, and about arsenic, which are very familiar heavy metals that have been around forever. So there's really 2 different ways to approach this. And some of the reasons old comes back again is changing technology. Before what we could detect only in parts per million, now we can see in parts per trillion or even lower. And so sometimes we just figure out that in our human bodies is a body burden of some of these contaminants that we really weren't aware of before. Sometimes research is done in the case of arsenic, and the MCL, the maximum contaminant level, has been lowered because of the additional research that showed the old level was not protective of public health. So these are some of the issues that come at us in the field of contamination. And, there's different ways of using materials. I'll talk a little bit about some interesting experiences we've had with mercury and lead and ways you may not expect people would be exposed to those 2 contaminants. And so these are just some other things to think about. And it's interesting, when I started putting this together, I started thinking, okay, well, what new things can I touch on at the beginning? And one of the things I came up with was pharmaceuticals in the water supply. And interestingly enough, Nancy shared with me that you had just put out a request for funding announcement for that exact topic, and then someone else came up to me before the presentation and said they were doing some research on that as well. And so this is one of the true emerging things that's coming at us. And honestly, at IDPH, at the Public Health Department, I'm not aware of anyone that has worked yet on this issue in any capacity. And so I did some research on the internet because, as usual, other states are ahead of us in their determination of the problem and their analysis of it. But basically, all of the medications that we are prescribed and take can end up in the wastewater of our water system. And that can be through many different ways. Sometimes all of it may not be metabolized by the body, or the metabolite itself might contaminate the water. Another way is, how were you always told to get rid of your medications? Flush them down the drain. Exactly. And what do you do when you flush them down the drain? You put them right back into the water supply. And I did a little bit of research before I came today, and they still do recommend flushing for certain materials. And those would be things like OxyContin, which they're having trouble with people selling the pills and those stronger narcotics. They still recommend flushing those down because of the chance that people could get a hold of them if they're disposed in the trash. But interestingly, the newest recommendation says do things with them like if you have used kitty litter, mix your pills into the used kitty litter, coffee grounds, anything that would make them unpalatable for a person if they found them in your garbage. And you might think, well, who's looking through the garbage? But there's some fairly resourceful people out there looking for these types of medications. So that's some of the new ideas on how to get rid of them. But this isn't really, it's emerging, but it's not brand new. In fact, in the mid-1990s, a German researcher decided to go looking for some of these common pharmaceuticals in water and actually found 30 of the 60 most common listed pharmaceuticals in the water supply. And so this is increasing over time because prescriptions are increasing, populations are increasing, and so all of this continues to be added to the wastewater and to the water supply of the world. The United States Geological Survey has a really great website if you're interested on this topic. I've listed it here. They've done quite a big sampling project of streams across the country looking for these pharmaceuticals. And so they have a lot of different reports and things that they have published as a result of their study. So if you want more information, I encourage you to visit that website and check out what they've done. As far as the impact, currently we really don't know a lot about what the impact will be. Again, one of the most challenging exposures in toxicology is a low-level, long-term exposure to determine what the health effects might be. And so that's exactly what we're talking about in this case. There's low levels of these pharmaceuticals in the water. We know that we're being exposed to them by drinking water, but the outcome of what's going to cause or what effect it will have is still unknown. It is known, however, or thought, that definitely aquatic life obviously will be affected before the humans are. And so that's one of the reasons they're looking at the streams and taking a look at the water quality in the stream and then also the aquatic life to see how those two are parallel and if there's health effects in the aquatic environment from these contaminants. Another interesting thing they talked about is how in places like Florida or West Coast where they have large retired populations, they see more pharmaceuticals in the wastewater because older people take more medications and take more prescription drugs, and so they actually see a higher level of pharmaceuticals in the water supplies. And then also out west, where it's a more arid climate, some of their streams rely much more on effluent to cause the flowing of the streams and the water supply. So you're not getting that same influx of water that we might hear in the Midwest with all of our wells pumping and things like that. They're actually getting a more concentrated dose out in the west where it's more arid climates. So these are all things that are going to have to be looked at in the future to determine if health effects will occur and what we can do to prevent the problem. Another one that's emerging, again, there's lots of different chemicals I could have talked about, but this is one that's fairly common, and they're polybrominated diphenyl ethers, PBDEs for short. And they were used as flame retardants. And interestingly, what happens is when you heat these up, the way it works as a flame retardant is the bromines are actually released and displace the oxygen around the fire to actually quench the fire, essentially, and keep it from burning. And they were used, these are 3 different types of PBDEs. If you're familiar with PCBs, polychlorinated biphenyls, the chlorines are in different positions and there's a different number of chlorines in each different type of PCB. It's the same sort of thing with PBDEs. And so you have penta, which is 5 bromines, octa, which would be 8 bromines, and deca, which would be 10. And so these are 3 different derivatives of PBDEs that was used commonly as flame retardants. And these are the different materials that each of those specifically was used in. So as you can tell, there's probably many of them in this building currently as we speak. And what's being found about these is that they last a long time in the environment and that they bioaccumulate in people. And so the level in people's blood is going up over time as these things leach into the environment and get into the air and the water and the dirt, and people are exposed to it. So they're actually finding now that most every human on Earth has a background level of PBDEs in their body, and that level is increasing. And so there's some work being done to try to phase these out. Some companies have voluntarily phased out their use of these materials and replaced them with different things, but it is still being used in the manufacture of some goods. And this is just because I'm a chemistry geek, and I like structures. The one on the left over there is the PBDEs, and then the PCBs over here. And you can see really the only difference is, besides the ones used as bromine and one chlorine, is this oxygen in the center. And that's what makes it an ether. Anytime you have anything connected by oxygen, it makes it an ether. But the important thing about this is the potential for health effects is because of this. And this is actually one of the essential compounds in the body uses in the thyroid of the body. And so you can see structurally how similar these two compounds are. And so one of the health effects of PBDEs is interference with thyroid function, and that is one of the health effects that they've showed that could occur. And so that's why they're taking a look into this and doing additional research to determine how much it would require to cause a health effect and what types of health effects humans could experience. And then our old familiar mercury. How many of you have played with mercury in your life, be honest? I moved into a new house recently, and it had one of those old mercury thermostats on the wall. And I wanted to replace it with one of the programmable ones. So I did a little home maintenance and wiring myself, all by myself. And I took the mercury one off, and that is a gob of mercury in those thermostats. I was not aware of how much is really in there. So we do a lot of these workshops and seminars, so I'm actually going to put some kitty litter in a plastic container, pack it up, and cart it around with me and hope it doesn't break. But I'll have it sealed very well and everything, and have kitty litter in the bottom. But it's really interesting that mercury is still very prevalent in the environment. It's still prevalent in homes, in businesses, in lots of the materials we use. Of course, dating all the way back to the Mad Hatter and Alice in Wonderland, it was the earliest diagnosed occupational illness, was exposure to mercury, caused personality changes, and it made people appear to be mad, and that's where the character, the Mad Hatter, actually came from. Schools contain large quantities of elemental mercury in the elemental form, typically in bottles on the shelf. And the reason for that is because every time they spilled or broke anything, what did they do? They couldn't get rid of it, so they scraped it into a bottle and put it back on the shelf. And so we've had schools with up to 2-liter bottles full of elemental mercury. One of the things that presented itself as a new issue was gas regulators. Up in the Chicago area, in the suburbs of Chicago, Nicor Gas Company found themselves in quite a situation. They had hired contractors to remove gas regulators just like these from the basements of older homes. Because when the homes were originally built, the meters and the regulators were put inside the homes in the basements. Well, to make it easier to read the meters, they were relocating all of these to the outside of the homes. So they were removing the regulators and the meters and taking them outside. What they didn't think about, or what they didn't warn the contractors to be careful about, is there's about 2 teaspoons of mercury contained in a gas regulator. So what was happening was they were removing these, cutting the pipes, and spilling the mercury in these homes. And so we had over 1,000 homes contaminated with mercury in the Chicago area. And we were involved in the clearance sampling and making sure that everything was cleaned up properly in those homes. But it's still occurring, which is a little bit frightening. It started in 2000, and I still get mercury results from occasionally homes where they're still doing it improperly and removing it. The good news, I guess, now is that they're aware of it. But the mercury in some of those homes had sat for about 10 years undisturbed. But it was in a basement where it was cold. It was usually in a closet where it was undisturbed, so it really wasn't evaporating very quickly. But in other homes, it had been tracked and things, so the exposure was real. We had about 25 people test with elevated urine mercury levels. but we didn't think that was too bad out of about 4,000 who were exposed. So it was a very interesting response from a public health perspective to something old, but it presented itself in a new situation.
What's that a picture of on the right?
On the right. That's from National Geographic. It's a picture of mercury. And it was taken in Peru, where they were actually mining the mercury. And if you have a chance to check it out, it was in the late 60s. I think the article ran in 69. But it's a great article because it shows somebody sitting on top a vat of mercury. Because the surface tension is so high, they can actually sit and float on top of the mercury. And then this was another picture. But the disturbing part about the article is it showed the health effects of mercury, which are central nervous system health effects. They had the miners try to trace a straight line, and because of the tremors in their hands, it was just completely jagged. So it's a very, very interesting article from National Geographic. But we always show that at the school presentations to the teachers. Arsenic is another one. It's a naturally occurring contaminant, typically in groundwater from the bedrock of the earth. And the maximum contaminant level, that's a level set by US EPA that is supposed to be protective of public health. And recently, in the past few years, it was lowered from 50 micrograms per liter, or parts per billion, to 10 micrograms per liter. And one of the reasons for that is a National Academy of Science report in 1999 said it was not protective of public health, that lower levels of arsenic could cause cancer and different health effects. And so US EPA revisited that MCL and lowered it. So again, even though the contaminant's been around for years, new technology and new research led to a lowering of that maximum contaminant level. And interestingly, I took this quote from US EPA's webpage, and when they set these levels, they have to maximize health risk reduction at a cost that is justified by the benefits. When they lowered this MCL, it impacted about 10% of the water supplies across the United States. And some of them, some individual water bills for individual homes went up $38 to $300 per person, well, per home, depending on what technology that water supply had to institute to get the arsenic out of the water. So that's some of the ramifications of lowering these levels and doing different things and different research. So it affected a lot of the water supplies across the country, and they had to do new things and then start filtering in different ways to take out that extra arsenic. Lead. Lead poisoning prevention programs have been around for a very long time. The level of lead allowable in children's blood has been reduced over time from 25 to 10, and it's probably going to go lower in the future, I would guess, because they're figuring out that there really is no acceptable level of lead in the body. Lead can affect IQ, it can affect development, and so in children, it's very dangerous. Most sources of lead are still things as common as lead paint. Leaded paint was commonly used in homes, and so children who live in homes with those paint chips, their hand-to-mouth activity are exposed that way. Lead is still found a lot in soil from industrial contamination, especially in areas like Metro East St. Louis, where they had a lot of factories spewing out contaminants. And so lead in soil is very prevalent in Illinois as well. Lead in pipes is still a hazard. Water contamination of water supplies in homes from the lead soldering used in the piping of the home. But interestingly, there's also new research and new ways that people are being exposed to lead. One of the most recent things we just encountered was a powder called Sindor. Well, that's one of the names for it, that was imported into the United States. Now, this powder is not edible, or wasn't supposed to be edible. However, the label said, best taste in town on it. And so a lot of people were confused by it and actually were adding it to food items and dishes. And one of these products tested at 87% lead. And so there were lots of people who ended up lead poisoned by this powder that was sold in ethnic markets and things. Apparently, even the distributors and the sellers misinterpreted it, put it with food type items, sold it, they mixed it into food, and people were being poisoned by this powder. So interestingly, even though it's an old contaminant, this was a brand new exposure pathway. Since all of those have been recalled and pulled off the shelves in Illinois, but we don't know how many people had it in their homes or used it in cooking, especially children's food. Yes? It's a decorative coloring. Lead, it has strong color, and so it was primarily supposed to be used for coloring of materials and things like that. So I don't know if people are misunderstanding it wasn't a food coloring or if it was interpreted as a food coloring or something of that effect, but that's the purpose of the powder. A new article just came out in the last couple of days about how lead exposure early in childhood or early in years may contribute to memory problems in older adults. And that's a fascinating article. I put the link up here. Again, new research showing that not only does lead poisoning perhaps affect developmental and IQ at a young age, but it may actually cause additional problems when people get older. And it may actually contribute to memory loss in later years. So again, all these things, even though they've been around forever, we're figuring out different ways they can affect us. And we're also usually figuring out that even lower levels than we originally thought can cause problems. Methamphetamine labs. Meth labs are interesting because they really reached a peak in the last few years, and now they are on the decline again. But just because they're on the decline doesn't mean that the hazard or the exposure to chemicals isn't still there. A lot of what we're seeing is instead of the big, large labs, now people are having them much smaller. And so people are going around and pill shopping in different states or different towns to try to get the pseudoephedrine they need to make the methamphetamine. One of the reasons we've seen the decrease is because of the new laws. If you go to the drugstore now to get a pack of cold medicine and it has pseudoephedrine in it, you have to go behind to the pharmacy and sign the logbook. And that actually has deterred a lot of the large production labs of making meth. But it's easy to make. It's not a complicated recipe. You can go on the internet. There's several different methods of making it. You can go to your local hardware store, with the exception of the pseudoephedrine, and find a lot of the materials required to make it. It is not difficult to obtain at all. One of the biggest problems is it contaminates the property where it's been cooked. So, you're using a lot of hazardous materials like acids, bases, and different things that actually seep into the drywall board, get into the carpeting. And then if people aren't aware that a meth lab was in that property, then children and others can be exposed to that. And unfortunately, children are exposed during the cooking process as well. We've unfortunately been involved with DCFS and things where children have been present when meth was being cooked, and of course their exposure is much greater. There's actually a study they did where they took a teddy bear and put it into a room where they were doing an artificial cook of methamphetamine for research purposes, and the teddy bear accumulated frightening amounts of materials on it. So it just went to show that children have a great risk of exposure if they're present when these labs are being run. This is just a typical picture of the materials you'd find at a meth lab. And again, it's not something we probably think too much about, but there's a lot of them out there. And, it's interesting. At Public Health, what we do, our role in meth labs is we write letters to property owners. So if the Illinois State Police or Police Department get a report of a meth lab, they forward that address information to Public Health. We look up the owner of that piece of property and we send a letter saying, this was a meth lab, here are some instructions on how to clean it up and how we recommend you take care of it and clean that up. Unfortunately, Illinois has no law for any type of clearance of properties. So we can give recommendations on how to clean it up, but we don't know how they follow that or what exactly is done with that. And so it's important that we all be aware of the potential health effects of these chemicals. This is just another picture. Again, as labs get smaller, they're finding them in the back trunk of cars. People are actually traveling around on the roads with these materials in their car. They'll stop in an isolated area and set up their lab and cook. The top picture is one of basically like a Rubbermaid type container, and in it is everything they need to cook methamphetamine. So it's just another hazard to be aware of and another potential contaminant of the environment. Obviously, if they're cooking meth, they're probably not disposing of things properly, and so things are going down the drain and things are going into the soil around the house and things of that sort. So again, another large source of exposure. And then we come to chemical storage in schools, and this is something we deal with a lot, and it's something because of all the mercury spills we got calls about. schools will have this mercury, and then students think it's cool because, let's face it, it is. It's a liquid element at room temperature. It's metal. It rolls around. It's pretty neat stuff. And what has happened is, a teacher would show maybe the bottle of mercury or whatever, and then the students would somehow get a hold of it and either take it home or spill it at school. And it has cost some schools hundreds of thousands of dollars to clean these spills up. But then we realized it's not just mercury. There's a lot of other contaminants in schools as well. You might be shocked if you walked into your child's middle or high school and went to their science storage area, and it sometimes appears more like a hazardous waste site, to be honest, because the materials are so old and they're in such poor shape, and there's so many of them a lot of times. This is a picture from a school we visited, and this was actually an 8-ounce Cool-Up container, full, absolutely full, of liquid mercury, but we joke in the workshops that it had the duct tape vapor barrier on it to prevent the evaporation. Because, again, the hazard with mercury is it evaporates at room temperature, so if you have a spill, it's going to evaporate, and it's actually the vapors you inhale that gives you the greatest route of exposure. About 90% is absorbed by the lungs when you inhale mercury vapor. And so it's a big risk to teachers, especially if they're in a classroom all day and they have a spill that they didn't clean up properly. They can get a great amount of exposure from that. A lot of times teachers have inherited supplies of chemicals. I just got an email yesterday. It was kind of funny. She was my old 8th grade science teacher, and she's now a chemistry teacher at a different school, and was lamenting how she had inherited this large chemical volume of junk, basically, she didn't want. And that's a story we hear time and again, because teachers move around, leave their stuff, the next teacher comes in, leaves their stuff, next teacher, and so on and so forth for years and years. And it can lead to all kinds of problems. This is a nice picture with shock value. It actually is from a school in deep southern Illinois. And this was a really interesting situation because we had a school that had no lockable storage area. And of course, the first thing to do to make things safer is to put it behind a locked door so students can't get a hold of it. So what the teacher had done is she had taken all of the worst from her room because it didn't lock. And the only place that locked in the entire school currently was an area under the bleachers in the auditorium. Now, the area under the bleachers had a door about this big, this tall to get in. So, we're ducking under the door. And this was in basically, the kind of cabinet you buy to put paper or filing supplies in, just a regular metal cabinet from an office supply store. And they had put all of this material in this cabinet, closed the doors, turned it to the wall, and put it under this area. Now, when we turned this around and opened it up, we were a little surprised and happy it hadn't blown up on us or anything, because there was quite a number of dangerous materials in here. But you can just see the condition of a lot of these materials. This is a cap that is probably the original cap, but has just degraded because it's so old and it's rusting off. These shelves were all completely rusty, and it was just a really bad situation. So this was one extreme occasion and form. Luckily, all that's gone. I'm happy to report, because what we do is we do collection activities with Illinois EPA. So we do the workshops and educate teachers about what to get rid of and why they should get rid of it. And then EPA comes in with their contractors and actually removes all those chemicals from the schools. This was another school in Springfield, and this was even a more interesting situation. This was what they called their district science center. And the person in charge of this had no chemistry training, no science training, no background of anything like that. She basically just shuttled supplies from one elementary school to another. Well, the junior high and high school teachers had a bunch of odds and ends and chemicals they weren't sure what to do with, so they thought, well, someone might be able to use them. I think they were pawning, but they sent them to the district science center because they thought, well, let's send them there. Well, then this person alphabetized every material she received and put them into gym lockers, as you can see in the picture, which made for interesting situations. Like up here we had ammonia, ammonium hydroxide, and hydrochloric acid, because she put it under A for acid, all in the A locker. And so, it became an interesting, amusing story, but also scary. There was mercury in here. And again, this isn't an elementary school. These were not locked. The door to the room was not locked. And it was just an accident waiting to happen. And so this has been a lot of the brunt of our work with chemicals in schools and trying to remove the chemicals from the schools to prevent these sorts of accidents and exposures. And then this is my contact information if you want to get a hold of me. I intentionally left time for questions at the end because, again, I was really a little unsure of what people were expecting from the presentation and wanted to open it up for more discussion or more questions about anything you were interested in, and I can sort of give you a Department of Public Health answer or perspective and let you know if we've dealt with that or whatever kind of questions you guys have. So, anyway, yes?
Locally, there's a controversial site
Yes.
in
Yes.
North Champaign. It's the site-
Manufactured gas plant.
Yeah, so I'm wondering what your experience or the department's experience is.
Sure. We have regional staff throughout the state of Illinois. We have 6 regional offices, and so our regional staff person is Kerry Ware, and he's been more involved with that site than I have. But, basically, we have reviewed data from that site. We're currently writing a document. When we evaluate a hazardous waste site, it usually leads to a written report. We have 2 different things we come up with. One's called a public health assessment, which is a much larger, broader document. And then we have a public health consultation. And so he's currently writing I believe he's writing a health consultation for that site to look at the data from public health's perspective. As far as what we know is he'd be able to speak better to the actual levels. I haven't actually seen the data, but we have to be very careful. A lot of our job is risk communication, and so communicating to the public is very important. And I think some of what went wrong was in the communication between the company responsible and the community. And I think there's a lot of mistrust and misunderstanding at that site that has occurred. And so one of the things we try to do is when we step in, we try to look at the data and help communicate the risk to the public and say, yes, there is a risk of health effects, or no, there isn't, and try to help them understand that. So I can't give you specifics, but I can give you the contact information if you want more from Kerry.
Yeah.
So. Sure, just see me afterwards, and I'd be happy to do that.
How is the public health assessment done? What is the methodology?
Sure. Public health assessment is written based on guidance provided by ATSDR. They actually have a public health assessment guidance manual that takes you through all the different steps and is available to the public on their website. But basically what we do is we look at pathways of exposure, how people are going to be exposed. There has to be a source or a contaminant. There has to be something. There has to be a way for it to get into the person, be it water, soil, however that is. There has to be a population to receive the contaminant, essentially. And so, we look at all of that. We take a look at the levels and try to look at whether the level is something that could cause health effects, or if it's low enough we don't expect it to. We look at the site proper, at the area around it to determine, what type of population lives there. We always do site visits as part of our public health assessments. And then we do dose calculations. It's basically like an ecological risk assessment, but from a human health perspective. So we do dose calculations to determine, okay, if this person drinks this much water with this level of contaminant, what's the outcome? And then we look at studies to determine if health effects will occur.
So, do you do any internal research at IDPH where you do your own, not necessarily assessment type stuff, but where you think there might be a need or there is a specific need in Illinois that may not be covered in some other place? So is there any internal research activity going on at IDPH? If you did have those kind of activities, what would those activities be? What are the areas that you think you would prefer to have more information, but it doesn't exist?
Sure. There's lots of information we wish we had. As far as do we do research, not specifically research the way you think of as typical research. When we do research, it's more looking at other states and what other states have done and looking at different sources of information about the material. What do we wish we had information about? There's all sorts of things. Another thing that we've encountered a lot in our hazardous waste site evaluation is chemical mixtures. It's one thing to look at individual chemicals and their effect on the body, but then when you start combining them, what is the health effect of that? Especially if they're the same type of material. For instance, if you have 2 chlorinated solvents like trichloroethylene and perchloroethylene, those 2 act very similarly. They want to attack the same organs. And so we typically add those exposures together to determine, the total exposure of a person. But there's not a lot of research with chemical mixtures out there, and that's something that ATSDR is looking at. They're probably the agency that does the most true research in the field of chemicals and human health. Yes?
Is Is there an official definition of emerging contaminants for the state?
Not to my knowledge. He asked if there's an official definition for emerging contaminants. Unless Illinois EPA has worked more with it from an environmental standpoint, again, at public health, something we're aware of, but it's not assigned to any specific section. Or, in fact, when Nancy's request came through, it came through our epidemiology section, who then contacted us in toxicology because they felt it was more appropriate to us. So my answer would be no, I don't really think there is a definition.
I know Army has a definition.
Okay.
Where there are toxic health effects known, but there is no regulatory limits.
Okay.
Regulations are being evolved.
Okay.
So that's why they call it emerging contaminants. But I was wondering if the state had any.
I don't think the state would have anything different, no. Mm-mm. Yes?
You know, if anyone's looked at the implications of all the advertising of pharmaceuticals for almost any imagined disease and the influx in the environment, I mean, it would seem logical to think there's an artificial demand being
created.
generated. And you know if anyone has looked at that, if there's any evidence or
Good
concern
question.
about it?
I don't know. His question was the effects of advertisement on pharmaceutical prescriptions and use, pharmaceutical use, and I don't know if anyone's looked at that, but obviously in the last several years, the number of commercials we see on TV, it's funny, I was having a stove installed last night, and for some reason I was paying attention more to the commercials, and it was like every other commercial was a pharmaceutical commercial for some malady or another.
That 30% of the population has.
Yeah, exactly. Yeah. No, I don't know, but I would guess. I mean, I know I'm actually applying to med school, so I have a very big interest in that as well. And I do know doctors are very frustrated by those commercials because a lot of times it brings patients in with, well, doctor, I want this, when that might not be appropriate for their condition or whatever. So I don't know what effect it's actually having on prescription rates and how many doctors just end up saying, well, okay, that's fine, whatever you want, and prescribing it. So I'm not sure anyone's looked at that.
Does your group issue any kind of an annual report that looks at state of contaminants in the environment as you confront them and emerging issues and where we headed, that type of thing?
No, we don't have an annual report. We do. Again, most of that would be documented in our public health assessments and health consultations, which are all available on the internet. Again, those are going to be site-specific, but that's more of a continuing running document of everything we do. We also have a lot of fact sheets we write on specific contaminants, so that'd be one way of looking at things. Obviously, we've developed fact sheets in the past few years for methamphetamine laboratories. We've developed them for some other contaminant issues, so that'd be another way, but we don't do formal reports. Yes?
Tomorrow there's a speaker talking about Lake Depew down at the water survey. Has your office have a position or whatever on Depew and its environment?
We have been involved heavily with New Jersey Zinc and with Lake Depew and the contamination, heavy metal contamination in the lake. Again, it's one of our regional office staff actually that handles that primarily, and I could again put you in contact with her.
Heavy in the lake, but there's
Well, there's all around the site, exactly. When we look at a site, we look at every possible route of exposure, and so we do have existing documents evaluating New Jersey Zinc and those sites.
Did you conclude there was a public health risk?
I don't remember. We've written over 100 public health assessments, but you could get that. I can give you the web address to get a copy of it that would actually tell you about that. So yeah, again, we're involved with lots of different sites. Yes?
I've seen a lot of public information about, how everybody should switch to compact fluorescence.
Yeah.
I haven't seen basically anybody saying, these contain mercury,
Right.
this could be a problem.
Funny you should bring that up. Interestingly, we are in the process of actually distributing a memo to our local health departments around the state of Illinois. Actually, it'll probably go out today about how to clean up breakage of those and the impacts they can have on the environment. They contain a very, very small amount of mercury. That's the good news. Basically about 100th of what's in a mercury thermometer, and the mercury thermometer doesn't contain much. So they are very minute amounts. However, I think there is a great misunderstanding that they do contain mercury. and as such should be disposed of properly. So we actually are just starting to try to do some education with local health departments and different people, because what we got reports that people were vacuuming up broken bulbs, which probably won't cause any great health hazards. However, if you vacuum mercury, it aerosolizes it all. It can contaminate your vacuum, and so there's some issues with that. So we're putting out this memo to remind people that yes, they do contain mercury and should be handled with care.
Don't most people probably throw them
Yeah.
in the trash?
I would assume
Seems
so.
like when we've got 200 billion of these things
Yep.
across the nation,
I know.
over a period of years, it seems like it's going to be a problem down the road.
It'll be an emerging issue in another 10 years. Exactly, yeah, exactly. And I think a lot of people justify it by saying, well, it's such a small amount. But again, when you take small amounts and add them up, it becomes an issue. So I don't think anyone's really looking that far ahead. Part of the problem is you can't regulate the private citizen. So we can't control what people do with that. Obviously, businesses and things you can regulate how they dispose of those. But the common person in your household, I mean, heck, if you break a mercury thermostat, you can throw it in the trash. There's no ramifications for that. Anything you do, you can throw away, unfortunately. But I think education is the key to help people recycle.
It seems like it would help a lot just to make it real publicly.
Yes,
Now, disseminate that information also.
I agree.
Give people a place to dispose of.
Yes,
Because
exactly.
As far as I know, there's no way to get rid of them other than throw it in the trash.
The only way I would be aware of is through the household hazardous waste collections that Illinois EPA has every year. And again, those are not convenient for some people because they're not very often. But I'm actually saving my mercury thermostat for one of those after I towed it around to a few workshops. But there are avenues, but unfortunately it's very difficult to find them. It takes a lot of research. Just like electronics, I had a computer I needed to dispose of. And I don't think a lot of people understand the heavy metals that are in electronics and computers. And trying to find someone to take that and recycle it for free, okay. Well, yeah, for free. Because a lot of people are like, you want me to pay to throw this away? And trying to get people to understand recycling and the costs of it. In Springfield, Illinois, we actually have one computer center that will take it off our hands for free and recycle it. But again, getting that information out there. Yes?
Currently, we have regulations for measuring certain contaminants in drinking water, and the water utilities are required to measure like heavy metals, disinfection byproducts, and reported to public. Do you think there is a need for new regulations to ask water utilities to measure also these pharmaceuticals or selected number of pharmaceuticals, considering the extremely low concentration of pharmaceuticals in water supplies? And then I'm wondering that if there is a need for doing such a thing.
Well, one of the things we kind of live by in toxicology section is don't go looking for something unless you know what you're going to do with it. And so his question is, should we be looking for these contaminants in water supplies? And I would caution us that if we do go looking for it, we're going to find it. I mean, it's going to be there more than likely. We're going to find most anything we look for. But then what are we going to do about it? Or what are we going to tell people? If you look for pharmaceuticals in water and we don't have a good handle on what health effects they cause at what level, then what do you do with that information? I guess is sort of the question.
I'm asking about the water which is supplied to public, drinking water.
Right.
That there is no regulation now for measuring pharmaceuticals.
Right.
Right.
Exactly.
So you think there is a need for having this regulation?
I think they need more research on the health effects and at what levels. I think that's the piece that's missing is we know it's there, but we are not sure about what kind of health effects it's causing to humans.
Is there any report on looking at the concentration of these pharmaceuticals at drinking water samples, not water supplies, drinking water coming out of the...
I don't know the answer. I'd have to look it up. I don't know if people have looked at it actually in drinking water supplies and how much purification. Yes?
It seems like if you did want to do, say, pollution prevention to make sure the pharmaceuticals don't go down the drain, one solution could be, say, composting toilets, and it's a possibility. Are you aware of any research that kind of discusses from public health viewpoint the benefits and maybe any other unanticipated problems that might arise with, say, composting toilets? I know there are, when people try to go to visit water distributors and stuff like that, there are actually barriers that come from sanitation departments and public health departments that prevent us from going certain routes.
Mm-hmm.
So we come across, from a pollution prevention perspective, we come across these barriers that seem like they are erected for maybe good purposes in the past. Are they being re-examined?
Well, again, you've hit on that sort of cost-benefit analysis thing with public health, and unfortunately, it's sort of the bane of public health. One good example of that was they decided that in Peru, I believe, that they shouldn't chlorinate their water supply because of trihalomethanes were being formed. When you chlorinate water, you get some byproducts, and they decided that those were too dangerous. Well, when they quit chlorinating the water supply, thousands of people died from cholera because of the bacterial contamination of the water. So your question is, do these sanitation barriers prevent the use? It's just that...
My question is more fundamental than that. Where do you go if you don't do your own research? Do you solicit research on these effects from outside body? Or how do you go about developing these policies, and how do you change them to adapt to whatever is happening? So it's not static by any means, but it is changing. But how does it change? What is the mechanism that goes on behind closed doors at IDPH?
Well, to be honest, toxicology regulates nothing. We don't regulate anything. So we really don't develop sweeping policies or any kind of regulations or sanitation requirements or anything of that sort. So for me, it's kind of hard to answer that question. A lot of what goes on behind closed doors is what goes on in the legislature, to be perfectly honest. How bills are passed in Illinois and where those come from and how they affect policy.
You don't inform policy as it is?
We don't what?
Inform policy.
Oh, yeah, we do bill reviews all the time, yes.
Based on some kind of research, I assume. If the research doesn't exist, do you call for research?
Well, we go looking to see if it exists. And if it doesn't, then we really are kind of stuck, to be perfectly honest. I mean, a lot of times what we'll do is call other states and say, hey, have you dealt with this? And if so, where did you get your information? A lot of the research comes down from a federal level. I mean, a lot of the federal agencies have the most money to do the most research and have the ability to do that. So a lot of what we look at is something people have already done. If it doesn't exist, then we try the best we can to either figure out where we can get that.
Well, the reason I think Nancy and I are interested in this question is we want to see if there are ways in which we can interface with IDPH.
Sure.
If there are really well-defined needs, maybe we as agency can help fill some of these gaps there.
Makes sense.
I think we're doing one project, I'm sure you're aware of it, with SIU Manoj Mohanty on the effect of drinking contaminants and adverse pregnancy outcomes. And that actually the ideas came from IDPH.
Yeah.
If we wanted to get these flow of ideas, what would be the best mechanism to make sure that we are talking to each other and making sure that we are responding to some real need out there?
Exactly. Yeah, good question. I'm not sure I can answer that, to be honest. Short of, we just never have had the opportunity or been contacted by anyone with that kind of interest in helping. So I think this will help considerably, having contact.
Jennifer, thank you very much.